Hey lovelies, you're welcome back to my channel. If it's your first time here, my name is Nurse MJ. I'm a nurse, a career coach, and I'm also a mom. On this channel, I share everything nursing, and I also share lifestyle vlogs, motherhood, family, all that sort of thing. If you're interested, kindly subscribe to my channel and make sure you have my post notification bell turned on. In this video today, I just want to quickly discuss with you the non-clinical nursing roles that you can switch to if you are tired of the bedside. I get it, a lot of people are burnt out on the bedside and they're like, you know what, I'm leaving nursing. What if there are other options that you can try instead of leaving nursing? And that is what we are discussing in this video. If this information interests you, keep watching this video. There are loads of nursing roles that are off the bedside that you can try as a nurse if you are tired of the bedside. Okay, you do not have to quit the profession. We need you. We need you in other sectors. A lot of nurses do not know that these kind of opportunities exist. Anyway, this is why I am here to inform you of this kind of information. I've got a list of 6 non-clinical roles that you can switch to as a nurse. Okay, so let's get to it. The first on my list here is called project management nurse. So project management simply means that you will be overseeing projects that improves patient care. Maybe they want to develop a kind of safe system for checking patient vital signs and ensuring that you document them on the spot. You will be involved in these sort of projects. Okay, you're also going to be involved in creating or implementing new systems that are safe for patients and other consumers. And if you're interested in this profession, all you need to do is to get a course that is called project management course. It's a tech course that you take for either 5 months or lesser. You can do it completely online. If you're interested in this, I have a company that I can recommend to you that are good, they are tested and trusted, and they will help you get the right skills. With these skills and your current nursing degree or diploma, you can switch swiftly and easily into becoming a project management nurse. Let's go quickly to the second on my list, which is clinical research nurse. The clinical research nurse is of course involved in researches that are related to healthcare. For instance, let's take for instance the COVID period. During the COVID-19, a lot of researchers, a lot of nursing researchers were also involved in checking, taking data about what is going on, numbers of people infected, number of people affected, the demographics, and that sort of thing is what a clinical research nurse is into. This is what they specialize in. They majorly play a vital role in clinical research. If you want to become a clinical research nurse, it's pretty easy. As long as you're already a nurse, you have a diploma, you have a degree, you also need relevant experience within the clinical research area that you are interested in. Okay, these are the major qualifications that you need. Let's move to the next one, which is a nurse informaticist. This one wants to break my teeth. Nurse informaticists, they use data to create new processes that improves patient care, their healthcare outcomes, and also clinical nursing practice generally. And how do you become a nurse informaticist? How do you become a nurse informaticist? you're already a registered nurse, which is your basic requirement. Okay, you have your NMC pin, you have enough clinical experience, at least about a year to 2 years, and you also have the relevant skills either in computer science or data analysis. These additional skills will improve your chances of shifting or switching into this profession. Now let's go to the next on my list. The next on my list is nurse educator. This one is just as it sounds. They're nurses, senior nurses that simply provide information. They teach and they educate nurses or student nurses, and they can do this as clinical instructors within the hospital or outside the hospital. If you're interested in this, you majorly need to be a nurse, of course, have your degree, a master's degree or a bachelor's degree in nursing. You're registered and you have at least 2 to 3 years of experience working within the clinical area. You know how things are done and you're able to support nurses and also student nurses. Next on my list is nurse advisor. Nurse advisors simply they provide clinical expertise and support for both patients and professionals. And if you're interested in becoming a nurse advisor, you basically also need your nursing degree, which you already have, BSc, a master's degree. You have to have sound leadership and communication skills, which you can develop by taking extra courses online to support this. And if you're already within the NHS and your hospital, you can always speak to your practice development nurses to support you in developing these skills through taking of the right courses, or they have the right materials for you to do this. Early on my list is nurse prescriber. Nurse prescribers, they perform consultation and patient assessment. You see them, they are top roles, and you need to be a senior nurse to get on this level. Okay, and there are special nurse prescriber courses that you might be required to take, as well as being a nurse practitioner. You might have to go back to the uni to develop these skills or to obtain this qualification. You will have to take a nurse prescriber course or nurse prescribing course. So you have to research universities that offers this course, and you will need to take it. Fortunately for you, if you're already within the healthcare sector, or maybe you're already within the NHS, you can also speak to your practice development nurse to know if this support is available, and you might be able to get sponsorship to become a nurse prescriber. When you finish your course as a nurse prescriber, you're going to be on top level band 7 or band 8, which is pretty amazing. That brings us to the end of my video. I hope you found this video helpful. If you did find it helpful, make sure you click the like button, okay, and also subscribe to this YouTube channel and have my post notification bell turned on. Follow me on my other social media platforms. I'll see you guys next time. Bye.